Welcome to DC to B Revolution. I'm Noah Volz, and this is where chiropractic students think big in order to live large. And today we have Dr. Chris DeMartini. He is a board-certified chiropractic neurologist practicing in Redwood City, California. And he is the co-director of California Neurohealth, a clinic dedicated to helping people with neurological disorders and pain. So, Dr. Chris, thanks for being here.
You're welcome. Thank you very much for having me.
So, Dr. Chris, really what I wanted to start with talking to you about today is this concept of clinical excellence and really being the best chiropractor that you can possibly be. What is your training and what have you done in your life to really ensure that you're offering the best quality care to your patients in your office?
It's a process of ongoing education and holding yourself accountable to delivering the best results, and not just delivering a good adjustment, but really looking at someone's overall function and that relative to the goals of why they came into your office in the first place. So are they getting what they wanted out of the experience? Are they able to live life more richly or fully? And how are you facilitating that? So, the day-to-day, what you're doing in treatment is very valuable, and having a broader set of skills to assess that level of functioning using, validated outcome measures, but also metrics that are relevant to the person's particular goals when you did your consultation in the first place. So that's where I start, and that's ultimately where the rubber meets the road, is how is their life better? And if it isn't, then you need to refer them to somebody else who's delivering those results. And if it is, great, keep moving. But that's what it's all about for me. That's why I got into this, to help patients, help people, and to change the world one person at a time so that they can go out and affect positive change in whatever way they choose. But that's why I do it. How I do it specifically, that varies patient to patient. But my chiropractic neurology background definitely colors what I do clinically very heavily. It's all about that. I got into chiropractic school knowing that that's what I wanted to do. I wanted to specialize. I had and still have mentors that are chiropractic neurologists themselves, and that's what I'm always intending to do. So, but that's definitely a process of lifetime learning more to know how to help people better. And what you do today might not be the same as tomorrow. I'm just always striving to be better so I can help others live their best life. So.
Yeah, and we talk a lot in chiropractic about personalized medicine, about treating the cause and not the symptoms. And what you're saying is you have these barometers, you have these tests, you have these metrics that you can really utilize to figure out if what you're doing is actually helping that person and supporting them reach their the goals that they have for care. Is that primarily through functional neurology, or do you feel like chiropractic has some really valid tools in terms of offering personalized cause-centered care?
And certainly there are valuable tools in chiropractic. I use them every day. I look at functional neurology or just neurologic rehabilitation as an extension of that, right? If you're going to be treating the spine, for example, you need to understand all the systems that play into that. What actually is posture? What is core stability? What are the neurological substrates of that system? And how can you assess all those? It's great, palpate and adjust, but look at the big picture. Did your adjustment improve core stability or did it not? If someone's balance goes to crap after you adjust them, maybe you didn't do the best thing. And if you don't understand why that is, then hit the books and develop a deeper understanding, or at the very least, go a different way treatment-wise until you can improve those parameters. So yeah, I mean, we learned all these examination procedures when we're in school. They're all valuable. If we're going to be treating the whole person, and you believe strongly that an adjustment is going to help their overall humanism and health, then put it to the test. If you think adjusting helps people breathe, then why don't you measure their respiratory capacity, rib motion, and, you know, put it to the test. If someone's supposed to have better muscle strength after an adjustment, then test it. If someone has better digestive function after an adjustment, put it to the test. It's one thing to assume that you're doing the right thing. I can tell you that plenty of times I thought I was on the right path helping somebody, and if I didn't care to look, I wouldn't have known that I wasn't on the right path. So yeah, chiropractic has a lot of valuable tools, but the main principle is non-pharmacological, non-surgical care. Is the adjustment the only thing we do? No, we take history, we do a review of systems, we do a full physical exam. Adjustment is part of that. It's the thing that's uniquely ours, but it's not the only thing that we do, in my perspective. I know that's swimming against the stream or going against the grain for a lot of people, but that's just the way I choose to practice, and I would encourage many more people to do the same. We'll help more people that way.
Yeah, thank you for that encouragement, because I think sometimes we can, like you were saying, sometimes you can get stuck in, because you believe something, you do that thing, but you don't have those objective measures. You don't have the parameters that tell you when maybe your style of practicing isn't the right thing for that person. You know, something I heard you say earlier was like, if I'm not able to get the results I want, then I'm going to refer them out. And so instead of being kind of a silo, you become more multidisciplinary, and you start to determine when what you're doing is really effective and when it's time to, you know, pass that person down the line so that they can get better. And that seems to me what's really unique about you and really beautiful is, like, your ultimate goal is ensuring that whoever walks in your door gets the care they need and you know, gets better ultimately, so that they can do the things that they want to do in their life. So, you know, have you always been that way, or is this kind of something that developed over time as you started to practice?
I would say I've always been that way, because I had the intention originally, and thinking that I could, and realizing it's way too much for one person to take on, was to go to school for traditional Chinese medicine and chiropractic. And as I got into chiropractic and mentors took me under their wing, I realized that's too much for one person to be excellent at everything. And being a jack of all trades, a master of none, has never been something I'm interested in. But my own clinic is multidisciplinary. My wife, she's a licensed acupuncturist. She practices alongside me. Most of the people we treat benefit from both of our skill sets, and they're different. Complementary, you know, additive, and quite often synergistic. And if I were to limit someone to one treatment modality and not allow them access to her, or vice versa, then people would be coming up short. And there are people that come into our clinic. We both sit down and do a consult with them from the get-go to clarify why they're here, what they hope to get. And, you know, is there a path that they foresee? What are they open to? There are people that come in, by the time they've been to my clinic, they've had way too many bad chiropractic experiences to ever want to go that way again. So I'm not going to try and push them. I don't care what they do. I don't care if it's in my office or not. Essentially, my goal is that they get better. So that's my service to the community. And there are things that are outside our scope of practice, things that I don't think I do well. Sometimes people come in and want me to be someone or do something that I don't, because somehow I impressed upon them, or they were referred to me with, you know, glowing praise, and they think I'm the answer to their problems. And it may not be how they think it is. I'm the answer, and then I'm going to point in the direction of the person that's going to be best to do what they need or get them closer to what they want. But no, I mean, there are people that we consult that I have to turn away. It wouldn't be ethical for me to do otherwise. Even if they absolutely want my help, I'm still helping them to move them down the path. Healing is a journey, the way I think of it, and that sometimes I'm a step along the way. Our perspective has always been, and I say this from day one, that if we're truly helping you, then you won't need our help eventually. If we've educated you properly, if we've empowered you to make the changes necessary in your life to take the power back into your hands to truly restore your health, then I'm a guy that you see every once in a while for a new thing when life gets beyond your ability to maintain your health. At the end of the day, an adjustment is a passive modality. It's not an active thing. People can't do it to themselves or do it for themselves. They can actively go seek it. But if I've made them healthy, and this is where I will ruffle quite a few feathers, you won't need an adjustment. So I don't want to go too far in that direction and piss a bunch of people off, but truly, my goal is to make them healthy so they don't need to see doctors. So if I have a piece in that, great. If I don't, I don't. There are people in my office that treat exclusively with my wife, and vice versa. The majority of people do both until they don't need it anymore and they're better. Or they don't get better all the way and we have to send them for something else, or we co-manage them. It's just, I think all of us have some amazing skills for the right person in the right situation to get them better. And we're here to help people realize that. So.
Yeah, I think it's so important what you're saying about having this level of integrity where you really recognize your scope of practice, you recognize what you do well, and when people come in, you take a thorough enough history to figure out, like, is this the right candidate for the type of care that I'm offering, or is this better for the type of care my wife offers, or maybe referring to somebody else, and really like adhering to that level of integrity. And I know, students, as a student, and also, speaking primarily to a student audience, like I feel like integrity and mastery kind of go hand in hand. And I feel like you've done a really good job, like you said, of like really refining one particular skill set that you're really good at. You're really good at that clinical skill set. So as a student, beyond focusing on chiropractic neurology, do you have any advice to other students who really want to like master, clinical, those clinical skills?
Not unique to chiropractic neurology?
Well, maybe chiropractic and neurology can kind of encompass those, but I'm just like looking for some kind of hands-on, like if somebody gets inspired and realizes they really want to like offer this high quality of patient care, like what's the thing that they can do today or tomorrow to like start moving themselves in that direction?
Well, I mean, whatever thing that they choose to specialize in or master, then they have to dive deep into it and seek out mentorship. You have to expose yourself as much as you can to whatever it is you're choosing to do. You're not going to do it from the comfort of your own home. You have to get out there, see it done by people, get your hands in, volunteer, whatever you have to do to get the exposure you need. If you can set up some type of a mentorship program. I was lucky enough to have my mentor take in as many cases as possible to develop my skills. And I got to ask questions and I got to participate. That was very valuable for me. And if you can find that, great. As far as helping people on a high level, it's not just the technical skills of whatever your chosen technique is or your craft. You have to be able to consult patients. You have to be able to talk to people, become a master communicator, to understand truly what a person, their goals are. Are they motivated? Are they confident? People come in with a whole load of baggage sometimes, and they tell you what they want, but they're in no position to be able to do what it's going to take to get it. And to take them in as a patient, if you're not ready to be able to get them to that place, is, it's negligent on your part. You have to understand that, because there are people that we pushed away. Hey, they're going through a divorce. They got this problem. That well can clear the air for them to be able to focus on what you're trying to convey to them. But there are other people that, we've said, hey, you need to go to marriage counseling. You need to do this. You need some of this or that before you can handle these things, because those are going to be issues that get in your way. You're not going to be able to make your doctor's appointments or your office appointments in our office if you're working 2 jobs and you've got court dates and you got all this type of stuff. And it's awful to think you're going to let someone suffer, but really to be able to benefit from what we do requires active engagement. So I think there's a lot of communication aspects that you pick up with practice that I don't know that they teach very well. Well, they don't teach very well in school. But the first thing you do when you're counseling a patient is, greet them, make them feel comfortable in your office, hospitality first. You're building more building of their life. That's a review of systems isn't just looking head to toe at all aspects of their body and physiologic systems. It's looking at the big picture of how that plays out in their life. And social history is a huge piece. So I think reading some books on appropriate history taking, doctor-patient relationships, developing a rapport, doing an appropriate interview, those are very, very important skills that I didn't learn very well in school, and those are things I studied extra. I think whatever your chosen specialty or technique would be, everybody needs those skills. I know what I chose to specialize in, but somebody may like X, Y, or Z. But at the end of the day, we all have to be able to talk to people and communicate. So that's the first thing we do. So probably the first thing you all should do to master your hand skills. You come out of school minimally competent with enough training to harm less than the majority of the patients you have. I mean, that's probably an exaggeration, but first do no harm is the goal. But your hand skills the day out you graduate are not going to be anywhere near where they are after a year in practice or 10. And those things are refined with repetition, as are communication skills. But you got to work in both. So that's my advice on how to connect with patients.
Yeah, I mean, I feel like that's perfect. I've heard while in school that determining your treatment plan, 90% of that comes from the history taking, and taking a really thorough history that guides your hand skills, that guides your palpation, that guides all of the other information that you can pick up. And so really refining that history taking process and refining your communication is key. So I know a lot of students are going to be curious, about how you do that, and curious about learning more about chiropractic neurology. So how can, if they want to learn more, if they want to see what other guidance you have for them, what's the best way to get in touch with you?
I'm sorry, the feed cut out or cut really slow. Basically say, what's the best way for people to get in touch with me?
Correct, yes.
You know, I got a website. You can reach out, CaliforniaNeurohealth.com. And they have a link on there. They can communicate with me that way. I get emails straight from the website. But, you know, I did most of my training through the Carrick Institute for Graduate Studies in terms of chiropractic neurology. Read books and talk with other doctors. You have to get out there and meet other docs and find out what makes them great. Everybody's got something for you. Some of the funnest times I had were interacting with other docs, you know, trading skills, trading tips, and learning from others. I mean, patients will teach you, other doctors will too.
Yeah, I mean, I love that you ended on that note, because we're a chiropractic community, and you know, the patients will teach us when we're chiropractors, and other chiropractors can teach us, and it's this give and take relationship. And so the more that we can work as a community and work as a collective and still have, you know, some unity within all of our diversity, the more all of us can grow. So yeah, thank you for ending on that note. This has been a production of DC to Be Revolution. We're helping chiropractic students to think big in order to live large. If you like this video, subscribe to the channel, leave some comments below. Would love to hear from you. And thank you once again, Dr. Chris Martini, for being here.
You're welcome. Thanks for having me.